You know, dry eye is one of the most common reasons that people visit the eye doctor.
And with hundreds of ophthalmologists in the city for a conference, we're going on call to find out more about chronic dry eye. Joining us from our newsroom is nationally recognized ophthalmologist and a clinical professor at Tulane University, Dr. Marguerite McDonald, and our old friend. It's so nice to see you again, pardon the pun.
Nice to see you both.
Doctor, first of all, tell us, what is dry eye?
Dry eye is a condition in which there is a decrease in the quantity and or the quality of the tears. So the tear film cannot fulfill its mission, which is to lubricate the eye and protect the eye against environmental irritants like dust or bacteria.
And what can cause this condition, Dr. McDonald?
There are underlying changes to the health of the tear-producing glands right under this bone right here, which we call the orbital rim. These changes are usually caused by inflammation.
And are there factors that could be considered a higher risk factor for dry eye?
Absolutely. We all get drier as we get older, but women are drier than men because of perimenopausal changes that start as early as age 38, even though menopause doesn't have its full onset on average till age 52. Also, there are medications. Many of the boomers, for instance, are now taking antidepressants or perhaps antihistamines. Certainly oral contraceptives have been implicated, as well as hormone replacement therapy. And there are diseases that cause dry eye. The autoimmune diseases like rheumatoid arthritis or lupus, they cause dry eye for sure. Also other diseases like thyroid conditions, thyroiditis, hypothyroidism, and hyperthyroidism, vitamin A deficiency, and Parkinson's disease. And there are many, many environmental conditions that aggravate dry eye as well.
So the question now is, what are the best treatments, doctor?
Well, the best treatments are, of course, artificial tears. There is also a twice-a-day medicated eye drop called cyclosporin emulsion. It's sold under the name Restasis. It causes your own body to produce more tears and higher quality tears. And it is the fastest growing medication in ophthalmology right now because so many of the boomers, once again, are getting old enough to be dry. So it's a long-term therapy, and it reverses the effects of time and hormonal changes on the lacrimal gland. So you go back to producing the type of tears you produced when you were 18.
All right. Dr. Marguerite McDonald, thank you for going on call with us tonight.
My pleasure.